Hello and welcome. Today we're diving deep into a lung disease called hypersensitivity pneumonitis. It's a condition that many people may not be familiar with, but it's important to understand, especially if you're exposed to certain environmental triggers. We'll explore what causes it, how it affects your lungs, what the symptoms are, and most importantly, how it's treated and prevented. So, let's get started. Hypersensitivity pneumonitis, often abbreviated as HP, is essentially an allergic reaction in your lungs. It's triggered by breathing in certain organic dusts, molds, chemicals, or even animal proteins. These aren't your everyday dust particles. They're specific substances that your immune system recognizes as foreign and harmful. Common culprits include mold spores from hay, grain or humidifiers, bird droppings, chemicals used in manufacturing, and even certain types of bacteria found in hot tubs. The specific trigger varies from person to person, and what causes HP in one individual might not affect another at all. Now, let's talk about what happens inside your lungs when you breathe in these triggers. In a susceptible individual, the inhaled substance acts as an antigen, initiating an immune response. This isn't a simple allergy like hay fever, it's a more complex reaction. First, the antigen stimulates the production of specific antibodies. These antibodies then bind to the antigen, forming what are called immune complexes. These complexes deposit in the small air sacs of your lungs, known as alveoli, and in the surrounding lung tissue. This deposition triggers inflammation. Immune cells like lymphocytes and macrophages rush to the site, further contributing to the inflammation and causing granulomas to form. Granulomas are small clumps of immune cells that try to wall off the foreign substance. Over time, this chronic inflammation can lead to scarring or fibrosis of the lung tissue, making it difficult for your lungs to function properly. While the exact numbers vary, hypersensitivity pneumonitis isn't considered a common disease, but it also isn't rare. It's more prevalent in certain occupations and hobbies that involve exposure to specific antigens. Farmers, mushroom growers, bird breeders, and those working in certain industrial settings are at higher risk. The incidence also varies depending on geographic location and environmental factors. It's important to note that not everyone exposed to these triggers will develop HP. Genetics and individual immune system differences play a significant role in susceptibility. The symptoms of hypersensitivity pneumonitis can vary depending on the stage of the disease and the frequency and intensity of exposure to the trigger. In the acute form, symptoms can appear suddenly, usually within hours of exposure. These include shortness of breath, fever, chills, and muscle aches. These symptoms usually resolve within a few days to weeks if the exposure is stopped. In the subacute form, symptoms develop more gradually over weeks to months and include a persistent cough, shortness of breath, fatigue, and weight loss. Chronic HP develops over months to years of ongoing exposure. Symptoms are often subtle at first, gradually worsening to include severe shortness of breath, clubbing of the fingers, and chronic fatigue. It's crucial to see a doctor if you experience any of these symptoms, especially if you suspect exposure to a potential trigger. Diagnosing hypersensitivity pneumonitis can be challenging, as the symptoms can mimic other lung diseases. The process typically involves a combination of medical history, physical examination, imaging studies, and lung function tests. Your doctor will ask detailed questions about your occupation, hobbies, and potential exposures. A chest X-ray or CT scan can reveal characteristic patterns of inflammation and fibrosis in the lungs. Pulmonary function tests assess how well your lungs are working by measuring lung volume and airflow. In some cases, a bronchoalveolar lavage, where fluid is washed into the lungs and then collected for analysis, or even a lung biopsy may be necessary to confirm the diagnosis and rule out other conditions. Hypersensitivity pneumonitis can be broadly classified into acute, subacute, and chronic forms, as we touched on earlier when discussing symptoms. The classification is based on the onset and duration of symptoms, as well as the degree of lung damage. Acute HP is characterized by sudden onset and resolution of symptoms with avoidance of the antigen. Subacute HP has a more gradual onset and may lead to more persistent symptoms. Chronic HP is characterized by long exposure and progressive lung damage, often leading to irreversible fibrosis. Understanding the specific form of HP is important for determining the appropriate treatment strategy. The primary goal of treatment for hypersensitivity pneumonitis is to reduce inflammation and prevent further lung damage. The most important step is to identify and eliminate the trigger. This may involve changing your work environment, modifying your hobbies, or removing sources of mold or other contaminants from your home. In addition to trigger avoidance, medications, such as corticosteroids, are often prescribed to suppress the immune response and reduce inflammation. In severe cases, immunosuppressant drugs may be necessary. Pulmonary rehabilitation, which includes exercise, breathing techniques, and education, can help improve lung function and quality of life. Oxygen therapy may be required if blood oxygen levels are low. In end-stage cases with severe lung damage, lung transplantation may be considered. Prevention is key to managing hypersensitivity pneumonitis. The best way to prevent HP is to avoid exposure to known triggers. This may involve wearing protective masks in dusty environments, properly maintaining humidifiers and ventilation systems, and implementing appropriate hygiene practices in bird breeding facilities. If you work in an environment with potential triggers, it's important to discuss preventive measures with your employer and healthcare provider. Regular check-ups and monitoring of lung function can help detect early signs of HP and allow for timely intervention. The prognosis for hypersensitivity pneumonitis varies depending on the stage of the disease at diagnosis and the effectiveness of treatment. Early diagnosis and prompt removal of the trigger can lead to a full recovery. However, in chronic cases with significant lung fibrosis, the prognosis may be less favorable. Recent research is focused on identifying biomarkers that can predict the progression of HP and on developing new therapies that target specific pathways of inflammation and fibrosis. Studies are also exploring the role of genetics in susceptibility to HP, which may lead to personalized prevention strategies in the future. Clinical trials are continuously evaluating new medications and treatment approaches to improve the long-term outcomes for individuals with hypersensitivity pneumonitis. Thank you for watching.